Hey everyone, this is Noel Liu back here again. I'm in my East Peoria office, and as we can see, business as usual. Today we are discussing another FFA, which is a fixed full arch. This patient, Jeffrey, came in with this problem right here. He cannot chew, he cannot smile, he cannot do a lot of things which life has to offer. So when he came in, he had all this missing teeth here. So we are going to dive straight into some of his clinical pictures, and as you can see some of his clinical pictures, we can see that he is missing a lot of teeth. His bite is fully collapsed, meaning that, because of the missing back ones, he's unable to chew and function properly. So that's another one of his biggest issue and complaint. So what are we planning for him? So the game plan for him is extracting the remaining, placing 4 implants on the upper and 4 implants on the lower. With that being said, he is going to be getting a fixed full arch temporarily, as it's going to be locked into his implants. So pretty much he's going to be getting a full smile makeover. So this is when he presented, this is post-op after he got his implants. So as we can see, we planned for 4 on the upper, but I went ahead and squeezed in 1 extra. And then on the lower, he's got 4. So 4 lower, 5 upper, fixed on a resin, and basically his thing was the same deal. We placed the implants in, did the scanning, sent it to the lab. The lab designed the fixed full arch for us, send it back into the office, and then we did an in-office printing. So once we did the in-office printing, this is what it looks like in resin, and pretty much it's got all the access, for the screws. We place it in the day of surgery. And it's very simple. So when that is done, we check patient's bite, we check everything looks good, we've checked the fitment, we checked everything. Pretty much it's all relevant based on the pre-op records that we took before him. So at that time when the patient presents, we have a lot of records that's been taken. So we take photographs, we take scans, we take x-rays, we take a cone beam CT, which is a 3D scan, and then we also take the intraoral scan, which is like inside the mouth. Once we have all that records, we transfer all that records to the lab. The lab basically uses that as a reference, and then when they are designing this, in case for Jeffrey, everything is merged together so that the function, the bite, the looks, the aesthetics, everything matches for what the patient was seeking. So this is after. So Jeffrey at this time, it's been about almost 4 months. He's still healing right now. All the implants are doing great. And after, the game plan is to get him one of these permanent arches. So the permanent ones are zirconia, and zirconia is nothing more than just hard porcelain. And when he heals, we'll just transfer that out, take an updated scan, take a scan after he's healed, send it back to the lab. The lab will make some adjustments, and then basically after the adjustments, we'll get the zirconia, and Jeffrey will be done.